All righty. Welcome everybody. Thank you for joining us for our 12th annual Medical Aesthetics Bazaar. Our topic right now is Dysport and filler. And our very own Melanie Reynolds is going to take it away here in just a moment. But first, I want to mention our giveaway for this session. We're giving away free 30-unit Dysport treatment, a free 30-unit Dysport treatment. You heard that right, at the end of this presentation. So if you'd like to be entered for a chance to win, go ahead and let us know in the comments, and make sure you stick around to find out if you won. You can also send us a quick email to info@empireionlaser.com if for some reason you're not logged into comment right now. So again, that is info@empireionlaser.com. And again, stick around till the end because that's when we're going to announce the winner. Also, if you have any questions for Melanie during the session, go ahead and write those in the comments, and then I will let Melanie know as we get towards the end, and she will answer those, or as many of them anyway as we have time for. And so without further ado, here is our aesthetic nurse, Melanie. Go ahead and take it away, Melanie.
Hey everyone, this is me. I'm Melanie. I'm excited to talk to you guys about some of my favorite treatments that I offer here at Empire Eye and Laser Center. So the 30 units of Dysport that you're sticking around for is really a phenomenal deal. If you're new to it, this is great. It's a $360 value. If you're an existing patient of mine, I'm super excited to be able to give you a free treatment. So I wanted to jump into the different brands. Dysport on the top left, Botox, Xeomin, and Jeuveau. Jeuveau is also known as Nutox. Those are the 4 brands of what we call neurotoxins that stop the muscle from moving. So it works, most commonly for those 11s in the glabella. When we get our furrow, mine's kind of kicked in, so I can't furrow very much right now. The products really all work the same when they're kicked in their effect. They are stopping muscle movement so that we can't raise our brows and create big horizontal lines on our forehead, smile and create big crow's feet. I mean, we can still smile. We're just softening those dynamic expression lines. There are some key differences in these 4 products that I think are important to note. So Botox is the one that most people are very familiar with. It has the biggest brand recognition, but it is a great product and it's been around a really long time. Dysport is really my favorite, and that's what you'll see is on special on our for this week, what's on sale and what we're giving away with this presentation. I like the Dysport because it kicks in the fastest. So for me, it's just the closest thing I can get to instant gratification. I did my treatment 5 days ago and it's starting to kick in pretty well. Botox really, for me, takes the full 2 weeks to kick in almost, whereas Dysport, I can see my results in less than a week. So again, that's just my preference, is to have the closest I can get to instant gratification. Xeomin works more like Botox. Is going to take longer to kick in. It's a little different in the way that it's manufactured, and it's more of a what we would call purified protein. Also a great product. Jeuveau is the newest one that's been on the market for just a couple of years. In my personal experience with Jeuveau, it wears off a little faster than the other products, so I don't use that one in my practice. I do carry Botox and Xeomin, but primarily use Dysport. So most of my patients are pretty familiar with that and know what we're using. So I like to just start out with a pretty, phenomenal photo to show you exactly what it can do. These are flip-flopped, so on the right side you can tell his before photo. I definitely didn't make him look worse, so these are flip-flopped. You can see that he's furrowing pretty strongly, creating a 1. Some people get 11, some people have a 1 in the middle there. You can see his forehead says some horizontal lines, and after treatment here he's trying to furrow and show me that he can't. He does still have a line that's there in the glabella area. When we create those lines pretty deeply over many, many, many years, it's going to take more than one treatment to see that fold really soften up more. So we might not ever make 100% improvement for him, but I think that's pretty darn good. If we had been doing treatment for a year, and this was only his first treatment, if we had been doing treatment for a year and still had a line that was there even after the treatment was kicked in, we have some other treatment options that we can look at to try to fill that in. So just bear in mind that when you've spent so many years creating lines and wrinkles on your face, one treatment isn't going to make you wrinkle free, but it's going to do a pretty darn good job. So our specials on the Dysport for this week are, there's kind of 3 different tiers. If you're a new patient to injectables for me, you can purchase anywhere between 40 and 74 units for $10 per unit, where it's normally 12. This is great to get started with. 40 units might be the right amount, might be too much, might be too little. I really can't tell anybody that without looking at them, evaluating their muscle movement, and deciding what parts of the face we're going to treat and where we're putting the product. So we would use that over multiple treatments. If we're just doing a light treatment on the forehead for 20 units, then this would get you, and you purchased 40, obviously that would be 2 treatments worth. So don't get too hung up on that. If we ended up, using 45 units and you only purchased 40, when you come in for your treatment, you can pay the difference. But you can try to gauge if you want to try to come in for a last minute consult this week with Rachel. I think she has a couple of openings left. If you really wanted to know how many units we would try to use per treatment. For my existing patients, we're really just encouraging patients to buy their year's worth so that you have it all covered. So you can obviously see the 2 tiers to bring the price down to $850 per unit. If you're not sure how many units you use, because so many people are really unaware of what they use, they just give me a lot of faith and trust, and I appreciate that. You're welcome to call our office. We can look through your chart and let you know how many we use per treatment so that you can do the math and figure out what works for you. This is a really good treatment, going back to that conversation I just had with the gentleman's photo about how the lines can still be there even after one treatment, but they get better with time. So the photo on the left, our left, is her first treatment, or before treatment, excuse me. The middle photo is the result after the first treatment, and the right-sided photo is her results after a year's worth of treatment. So you can see how with the same number of units, things get better and better. I have this conversation with patients all the time that with consistency, we can get to that sweet spot. One thing I'll note on this after treatment is her right brow, so left to us on the screen, her right brow is arched up a little high. I left this photo in here on purpose, but I do want to point out that that's actually an easy fix with a little drop of Botox. Some people don't know that when you get that extra arch, that it can be fixed so easily, and they end up being stuck with it. I guess I'm looking right here. Anyways, they get stuck with it and thinking that they just have to deal with it. Please come back and let me know if things like that happen. I'm happy to fix treatments for you. Don't walk around, with a little witch brow, okay? Again, looking at another part of her face is the furrows. You can see with repeated treatments, a year's worth, so 4 treatments, she has had such significant improvement by that last photo. So consistency, this crow's feet, being able to still smile but not create deep lines. Her eyes don't scrunch up so much when she smiles in that after photo. But that all is really Dysport, and we can use that to relax muscles primarily in the forehead and around the eyes is where most people use it. I think it's often not talked about what we can do in the lower face. So this photo on the screen is showing you the aging volume loss changes that occur over time. But if I was going to go to one more topic on Dysport, I want to mention that you shouldn't be living with a lot of wrinkles down here and wrinkle-free on the top part of your face. So we need to be considering, Botox and Dysport and Xeomin in the lower part of your face as well. But the other component of aging is not just your muscles moving and creating lines, it's also that we lose fat in our face. So this is a good image description to show you that we have fat pads all over our face. And as we have more birthdays, those fat pads, they get smaller, they shift around, and they shift down. So our face goes from this nice heart-shaped face to like more of a squared off, Lego face. So what you can see here, and it's happening really early on. A lot of patients will tell me, I'm not ready for fillers. I'm only in my 40s. I'll do that when I get older. But by 45, those changes are happening, and we are seeing the age-related changes that would require something different than Botox or Dysport to correct. Obviously, by 55, we've lost a lot more of our fat pads, and therefore we might consider using a lot more product to give the results. But fillers are fabulous. They, up in the temples will help open up the eyes a little bit, give an illusion of lift to the face. The peanut head syndrome really is where the fat loss starts, and then it moves down. So our cheeks get really hollow and they shift down the lower part of our face. And then, of course, anything in around the mouth. I think most people very commonly think about this area, the nasolabial folds, these marionette or puppet lines. Most commonly thought of areas to put filler. But really what's happening is everything out here is falling forward. So maybe we should start by replacing volume in the lateral part of our face. We use a number of different options to do that, fillers or Sculptra. Sculptra is a great product to stimulate new collagen, and Rachel's going to talk with you about that next, so we won't spend too much time talking about it now. When a lot of times I get asked by patients, what filler should I use? What should I buy when it's on special this week? I don't need you to figure that out, because ultimately that's what I'm here for. I am your artist, so to speak, when it comes to your face. And so these are the fillers on the screen and Sculptra, collagen stimulator, that I've decided are my favorite to use. I think it gives me the widest range of options, so that I can look at your face, what our goals are, and pick the right product. It's like having the right paintbrush, the right size, the right bristles, and all that to make sure we can achieve the effect that we want. The Restylane brand of fillers is my favorite. We've also recently added in a new, really very exclusive and beautiful brand of fillers called the RHA collection. They're great for more areas that move and we want to have that stretchability and that naturalness. So one of the things that's changed with fillers over the years is we don't want to just plump up and fill and have a stiff frozen face. We want to have naturalness and motion when we smile, laugh, talk, eat, that we still look normal, that it's not apparent that we've had anything done, but definitely that we look refreshed and more youthful. So that's what I'm here for, and these are the products that I'm going to pick in my toolbox. The specials for the fillers, which is a gel-like substance for Restylane and the RHA, are all the same. So they're normally priced $6.50. It's discounted to $5.75 for the event. The Sculptra has a different pricing, but again, I'm going to let Rachel go over that with you because it's a little bit more involved. So when we look at areas that we can place filler, I mean, I don't know what happened in 2020 because we all put masks on, but suddenly the entire world wanted their lips done. So I've had an incredibly fun time this last year doing like thousands of lip treatments. It's been really great. This is a picture that shows you kind of an example of my style. I'm not a big fan of huge overfilled duck lips, so to speak. This patient has a really nice natural shape to her lip. In the photo on the left, she really does have beautiful lips, and we just kind of plumped them up, gave them this hydrated look, but really didn't make them anything that she never had. So her lips fit and look natural for her face. Some lips are a lot trickier to do, whether they have an asymmetric shape from right to left or asymmetric in their sizes, or we got to look at whether we have thin bird lips, or like myself, if you have some natural larger lip, we don't want to over plump. You can very easily go the other direction. So I really like using my different fillers in my toolbox to make sure we can give you a result that looks good on your face. Another common area I get asked about is the tear troughs. And this is another area where you don't want to go the other direction. You don't want your under eyelid area to be puffy. That's going to make you look more tired than it did to have some hollowness there. So in her case, we did the under eyes and the cheeks to give her a little lift, because again, everything starts, all those fat pads in her face start getting smaller and sliding down the face. And so we used 2 different fillers to help give that volume back where it used to be. So she has these nice arched cheekbones, and the under eye, I left it a little undercorrected, which I would prefer to like teeter on that line of undercorrection versus risking going the other way and having it be overfilled and puffy. It can make her eyes look a bit smaller. So I think right here she looks really fabulous. This is another under eye treatment, so you can see how much improvement. That's just 1 syringe of filler, basically half and half to each under eye area, and no makeup, no concealer, just truly correcting those hollows. Some people have different problems with their under eyes. They may have bags that exist without filler, and those really are going to require a surgical correction. So it's a good idea to come in and have a consultation and let us help decide if you're a good candidate for filler or surgery, and we can make great recommendations. Or if we also want to look at other things that are causing our under eyes to look tired, whether it's darkness and pigmentation, wrinkles, the way the muscle moves under the eyes. So a consultation will help us determine what's the best outcome that we want, or best treatment that we want to achieve your outcomes. And then for the lower face, the top photo shows you in the red arrows the areas that I placed filler to help soften the lines, help give her some lips that weren't so wrinkly. And this is immediately after treatment when we did a touch-up 2 weeks later, so she's a little bit swollen. The areas that are the little blue X's show you where I actually did Dysport or a neurotoxin to help relax the muscle movement. So that's when I wanted to come back and mention earlier what I mentioned earlier about not leaving ourselves wrinkly right here. Again, so many times over the years I see patients who have been focusing their neurotoxin treatments on their upper face and they look great. they got a mask on and they look absolutely great up here, but when you take that mask off, the lower face is going to age you just as much. So making sure that we don't have the dimpling on our chin from not putting Dysport in this area to stop that dimpling of that orange peel chin. The corners of the mouth, you can see in her before photo, they really start to pull down because of muscle movement. And so when we put a neurotoxin there and we relax that muscle movement, the corners of the mouth lift, and some of the wrinkling and dimpling that we have go on here really relaxes and gives a very smooth result. So new lips might look nice, but if we still have lots of wrinkles around those lips, we can't really appreciate exactly what they've done for you. So as far as our specials this week, it's, I think, a phenomenal special. If you are purchasing one syringe, it discounts it to $5.75. Again, you don't have to determine what type of filler you're using. You're just determining how many syringes you want to purchase when you come in for treatment. I will help you decide which filler we're going to grab from our arsenal. And, you know, obviously the more syringes you buy, you can see up on the screen that the bigger the savings get. As far as Sculptra, now Rachel again is going to talk about this next. Sculptra is one of those products that you don't see the results from right away. It takes time to see the new collagen development. It is similar results to a filler, except for not in the lips or under the eyes, where you're really using it on the lateral part of the face. The results are just maybe even a little more natural appearing because new collagen under the skin gives a fresh glow, a healthiness that filler is not going to do for you. So Sculptra is really phenomenal. Now, we need more vials to start with. So if a patient hasn't been on a great maintenance program, or if they have had more birthdays, probably only my patients in their 20s and 30s could use one vial. After 40, we're definitely going to need to consider more vials. So that's why we package those different prices. And if you're not sure what you need, again, I would recommend a consultation. 4 vials is a great starting place, and we don't use them all at once. We spread those out over different visits. And Sculptra has some different instructions. So with Dysport and with filler, I tell you to not massage the area, leave it alone, let it kind of settle in. Whereas Sculptra, you want to massage those particles and move them around the face. We also definitely don't do those on the same day. So consider that when you're scheduling. Our packages, there's 3 of them. So the first one is our Bright Eyes package. It's going to include the filler for the under eyes, which you saw a couple of photos, the Dysport around the crow's feet, or bird toes, as a patient told me she called them one time. So those crow's feet lines are going to soften up and look really nice combined with filler under the eyes. And it also comes with a BBL, or our photofacial treatment, which is my most popular facial treatment that we do here. It uses broadband light to help improve the pigmentation and redness on the skin to give a really bright, fresh skin glow, which can be really important if we have some hyperpigmentation around the eyes. So again, you know, this package is built together for correcting the under eyes, but with a BBL or photofacial, you would have improvement all over the face. The Luscious Lips package is a way that we're pairing things together to address the perioral line. So a lot of people get really disappointed when they pucker or even at rest and they have those barcode lines. I mean, even if you've never smoked, we kiss babies. I kiss my 3-year-old all the time, so that's how I create those lines. I just use Dysport and filler to soften them so that I'm not having to look at them. And I'm also working on preventative maintenance. So in this case, the Restylane Kiss filler is my favorite for the lip because it's very soft and luscious feeling. It doesn't feel firm and hard because you want your lips to be soft and pliable, but it also has a good longevity. It's not so, it's not so soft that it just dissolves and goes away within a really short period of time. We can also use the Dysport to help relax those lines or help open up the top lip. So just kind of, we have a few units within this package that we can look at your lips, look at the muscle movement around your lips and decide how we're going to use those extra units. And then microneedling, which microneedling is a phenomenal treatment, again, for the full face. Great when we're addressing those perioral barcode lines. The needles, you know, go in and out of the skin at a rapid pace to cause lots of micro injuries on the skin, which then the body is stimulated to heal and repair that. So we get this nice fresh glow. It sounds really painful. It is not. I numb you very well. I always think, how would I want things to feel? And I don't like to be in pain. I'm kind of a baby. So I make sure I numb my patients up pretty well when we do microneedling. The last package is actually, I apologize, I didn't make it into the slides. We added this year. It's called our Chin Define. So I think I've really tried to make a big push on my Instagram, if any of you follow me, to recognize that we need to address the lower face aging. One of the things that happens as we get older is our chin actually protrudes and our face starts to have this backward slope to it. So we can use filler to help bring that definition out and a more heart-shaped face, and it gives that whole from top to bottom, takes that squareness away. So the chin define includes the filler, some Dysport to relax the muscles pulling the corner of the mouth down, and the chin dimpling for that orange peel chin, and it includes a photofacial. So kind of back to what I already talked about, full facial rejuvenation, I always feel is the best approach to anything that we're doing. We don't want just one area of the face to look good. I want all of you to look good. And then I think do we have any questions?
Yes, we have 2 questions.
Okay.
One question, do you have a recommendation for when to start preventative treatment for crow's feet? And as far as age, or do you take job into account?
Honestly, I take your muscle movement into account. So I have some patients that when they smile, their muscle just doesn't create lines, and we don't really need to do a treatment. It's not necessary to put product there if we're not creating lines. However, if you're smiling and you're creating some deep lines out here, even if you stop smiling and the lines completely go away, it's not a bad idea to start doing preventative maintenance, because when we create those lines, when we smile, eventually the skin breaks down, and that's what leaves us with what we call static lines. So those static lines are the lines that are there even at rest, that we have, not a smooth face at rest, but we still have lines that exist. So preventative maintenance is really about trying to prevent those things from coming on. And it's really never too late, because also I have hundreds of patients that those lines already exist, and we can still soften it. We can still make things look better. We just have to have realistic expectations that we might not have this smooth face. So back to that question specifically, it's really your muscle movement. That's what I'm looking at, and that's what's helping me to determine that, because that's so individualized. And how many units we use, we might use 10 to 20. It's very individualized. Some people smile more with their eyes. Some people raise their forehead and create lines up there when they smile. So a consultation would be best.
And what was the price again for the chin package?
Oh, excellent question. So it's $700, and the pricing of the package with those 3 things included is normally a little over $1,000. So it's a pretty decent savings.
And how often does someone need to Dysport?
Every 3 months. That's our goal, is to get you to that point that it lasts for 3 months. When you feel like you're not due for treatment until you're within that week that you're scheduled to have your treatment. Your first time doing it may not feel like you get as long lasting results. That's because your muscles are so strong, they're fighting to go back to normal. So it may only last you 2.5 months potentially. I mean, ideally 3, but realistically, we're just kind of fighting against your really strong muscles. So my encouragement is, if you like what the treatment did, if you liked the way that it looked when it was kicked in, be consistent. Do it every 3 months for at least a year, and then you'll hit that sweet spot where it's really lasting you between treatments, getting you that longevity. There are some other factors that play into longevity, including how many units we use, what areas of the face that we're treating, and sometimes your lifestyle. Unfortunately, people who smoke are not going to have as long lasting a treatment, and sometimes people who exercise vigorously. That's not all the time. I would never say don't be healthy so that your Dysport lasts longer, but it's a realistic concern that we might have. But I still would encourage people to be consistent, because that's when you're going to hit that sweet spot. The lines are going to look the best they've ever looked. They're going to relax the most, and you'll have the best longevity.
Okay. That's all the questions.
Okay. I know I speak kind of fast, so I think I sped through that. So hopefully answered some questions that you may not have had. And I think we're going to announce our winner.
All right, everyone.
This is my favorite part.
And Juana Castaneda, congratulations.
Yay!
You are the winner. 30 units of Dysport. Please go ahead and email me at info@empireinlasercenter.com. and send me your contact information, and I will reach out to you, and we will get this get you squared away, get you set up for that treatment. So again, thank you everybody for joining us. Melanie, thank you so much for this very informative session. And Rachel is going to be next, so stick around. She's going to talk about Sculptra. And remember, EmpireEyeLaserCenter.com/events. All the map information is on there. Other sit and sips happening today, tomorrow, and Wednesday. And of course, the full map special offer list is on there as well. So you can look through that and see all the amazing savings we have lined up for you all week long. So thank you again for joining us, and you all have an amazing rest of your day.